You might be wondering right now whether or not you're a good candidate for sedation dentistry. Well, I have great news. There are many different sedation dentistry protocols available. That means that your dentist can select the right one to meet your individual needs. Whether you're young or old, healthy, or have certain medical conditions, there are treatment options available. Sedation treatment can be beneficial for almost any type of procedure. It can make oral exams less stressful, remove the worry of having root canals. It can even be used for cosmetic dentistry procedures like veneers. Whether you require gum treatment, basic fillings, crown work, implants, or nearly anything else, there are sedation protocols designed to meet your needs. Your appointment will fly by and be over before you know it. A tremendous benefit of sedation is that much more treatment can be completed in a single appointment. Because you are fully relaxed, your dentist can work more efficiently, meaning you get the highest quality of dentistry possible in the shortest amount of time. You're probably curious to know what kinds of sedation treatments your dentist may use. There are several types of sedation dentistry available, including oral sedation, IV sedation, and inhalation sedation. Sometimes a combination of these methods may be used. Oral sedation utilizes pills taken by mouth to achieve sedation. IV sedation works the same way that any other IV treatment works, by delivering medication directly into your bloodstream. Inhalation sedation involves breathing in nitrous oxide gas, often referred to as laughing gas. Each form of sedation has its own unique set of benefits and advantages. You and your dentist will decide which type is right for you. It's important to know that all three types of sedation are safe and effective when delivered by a qualified and appropriately trained dentist. Many dentists prescribe a medication for you to take the night before your appointment, and then provide additional medication once you arrive at the office. This is normal and designed to ensure you have a relaxing and restful night of sleep prior to your treatment. The entire focus of your sedation dentistry appointment is to ensure you have a positive, welcoming, and effective experience. Your local sedation dentist can make this and so much more possible. Here are some testimonials from patients who describe their sedation dentistry experiences.
It works wonderfully. You won't feel a thing. You won't remember what's going on. It's not like you're unconscious. They can still talk to you and ask questions. You just don't remember about the procedure.
I really didn't remember a whole lot, but I was very comforted to know that I was well taken care of during the whole process.
Really, I don't remember a whole lot. I remember them setting me in the chair, and I kept thinking, man, I hope this works. I hope this works. And then next thing I know, my wife's there to pick me up, and we went home. And then I don't really remember. Like I said, I was really tired after the treatment, and so went to sleep. The next morning I woke up, my teeth were all good, and that's about how it works. You don't really remember a whole lot of it.
So I've gone under with conscious sedation several times. So it just works for me. There's a lot of work that can be done in a shorter time than if I wasn't under conscious sedation. When I hear conscious sedation, I think just comfort.
It was the best experience I've had with a dentist. I'm telling all my friends, oh, go to sedation, it's wonderful.
A properly trained sedation dentist will go through a detailed list of information with you prior to your sedation appointment. This includes taking your complete medical health history and discussing any medications or supplements you may take. Having certain health issues or taking medication does not eliminate you from being a candidate for sedation dentistry. It's just important for your dentist to know so they can discuss all of your options and determine the right methods and protocols for your specific needs. In fact, many people with specific medical, health, or physical conditions can greatly benefit from having sedation dentistry. Safety is the foremost concern of all sedation dentists. Their job is to make sure that every part of the sedation dentistry process is safe and effective. All of the dentists listed on SedationCare.com have been trained by Docs Education, also known as the Dental Organization for Continuing Sedation Education. They have set the gold standard for sedation dentistry, teaching excellence. You should feel free to discuss the sedation process with your dentist at any time. Be open to discussing your fears, concerns, or any apprehension you may have. Sedation dentists and their staffs are some of the most compassionate and kind medical professionals you will ever encounter. Their entire mission is to ensure you have a positive, comfortable, and relaxing experience. Rex is an expert botanist, hosts a radio show, and is a husband and father. Needless to say, he is strapped for time. He also has some anxiety about being in a dental chair. Let's take a look at Rex's experience.
Now that's worth 50.
I hate the dentist. Hated the dentist, let's say. Ever since I was a little kid, I hated going to the dentist. My teeth are extremely sensitive, and to have somebody playing in my mouth, just playing in the mouth is bad. But, they start getting the drill and it's a nightmare. It's horrible. I hated it. But occasionally I would force myself to go in and get it done. Driving along in my car and heard an ad for sedation dentistry. And I'm like, okay, that's for me. Something that relaxed me, I could deal with the dentist. Yeah, let's try it. And I gotta tell you, it was the best thing I've ever done. When I went in there, previous to me going in, they had me take a couple little pills, no big deal. So, I was feeling pretty relaxed. I wasn't tense and nervous like I normally was. Usually when I sit in the dentist chair, it's like, grasp my fist. It's like, okay, here we go. But, I was relaxed and, they treated me really nice, put a pillow underneath my legs, gave me a few more pills to put underneath my tongue. Next thing I know, I wake up, I'm at home. My wife had come and got me and I'm at home. All my dentist work is done and it's like, wow, that was awesome. And actually my wife came to pick me up and she came a little bit early and she said I was talking and they would ask me to turn my head and I would do it. But the great thing is I don't remember a thing, so. I don't know that it was courage that made me make the phone call. It was the lack of courage to go to the dentist without sedation that made me call. It was the fact that, finally going to the dentist might not be so much trauma. The world's coming to an end. Well, one of my visits took about 5 or 6 hours. There was a lot of dental work that needed to be done. But the great thing is time just went by like that. Visiting with my wife and she's like, boy, you were there a long time. I'm like, oh, really? I didn't realize that. And really wasn't sore the next day. Usually after sitting in the dentist office for 5 or 6 hours, your jaw would be sore and terrible. No problems.
Welcome to Garden Talk. I'm John Kerr with Rex from Town and Country Gardens, and we are here to answer your gardening questions.
Yes, that is true, but it feels a little cold outside this morning.
Well, it's the end of September.
A little chilly come Wednesday, 28 degrees.
Is that what they're saying?
Yeah. Sedation dentistry, I tell everybody about it, especially if they say, hey, I gotta go to the dentist. It's like, go to sedation dentistry. It's no big deal. Then you take a pill, and you're done. It's awesome.
Here's another testimonial.
My name is Theodore Anderson. When I went to the dentist, I had a partial plate, and it was awful. It was awful. It was falling down. I couldn't chew. I had to put all that Fixodent in my mouth and everything, and it was bad on my diabetes. It was make my sugar go up and down. I said, Doc, I have to get this partial out my mouth. So it messed around, control my diabetes. Now I don't have to do that. The implants they in there, they don't move. When I walked in the door, I was a little nervous, and he told me, he said, I don't have to take one pill. No pain, no worry. It just come out just like he told me. Woke up the next morning and I didn't have no pain, and I was just happy. I couldn't eat steak, hard meat, hard vegetables. It's always moved on me. But now, after I put the implants in, I can eat steak, eat raw, hard vegetables, I eat apples, and it don't move. It doesn't move. And all the food I eat now, I digest it better, I eat better, I looks better now. I like to smile. And you don't smile good when you have a partial in your mouth. And I tell everybody, don't be scared, because I was scared. but it's not painful. I'm eyewitness. I'm living witness. He's painful free. And I love that smile. I really do. It don't get no better.
Sedation dentistry can truly change your life. By making you completely comfortable and relaxed throughout your entire procedure, your dentist can work more efficiently. If you've been putting off seeing the dentist for weeks, months, or even years, now is the time to make a call to your local sedation dentist. Don't let another day go by in pain or discomfort. You do have the time to get treatment. You can be treated comfortably. Most sedation dentistry patients will tell you that it's that very first step that's the hardest. Reflect back on the real-life patients you've heard and seen in this program. All of them experience similar fears and reservations about seeking dental treatment. And now all of them, with the help of sedation dentistry, have smiles they can be proud of. It's not too good to be true. It's what sedation dentistry is all about.